Hi guys, it's Nurse Toya again. To this video, we will talk about vital signs. We're going to explain vital signs and what is vital signs. We all talk about vital signs. You always hear nurses say, what is the patient's vital signs? Yeah, this is very important. This is one of the main things that we do. Well, not main, but one of the very important things that we do when we care for our patients. So let's dive into this. What is vital signs? Vital signs is the measurement of the body's most basic functions and are crucial in assessing a patient's health status. Okay, so again, what is vital signs? Vital signs is the measurement of the body's most basic functions and are crucial in assessing a patient's health. So that's what the vital signs is. Now, what are the 5 different steps of vital signs? Let's get into that. So we have the body temperature. We have to assess a patient's body temperature. How do we assess a patient's body temperature? Using a thermometer. We can use a thermometer. We can check the tympanic. We can check oral, axillary, rectal. Okay? Body temperature. So we check the patient's body temperature to see if the patient is too hot or too cold. Okay? So the normal range for body temperature is 97 degrees Fahrenheit to 99 degrees Fahrenheit, which is 36.1 degrees Celsius to 37.2 degrees Celsius. Okay, so we know we can check this oral, tympanic, and axillary, rectal. We know we like to check it. Most places, the doctors really like oral temperatures. They say that's the most accurate one. The rectal is normally a little higher. We'll do another video where we'll talk about how to do vital signs. Okay? Next part is the heart rate. So what is the heart rate? The heart rate is the pulse. The pulse is the number of beats the heart beats every minute. So let's say our patient was assessed and their pulse rate was 60. Our normal range for heart rate is 60 to 100. So we want our patient's heart rate to be between 60 to 100 beats per minute. Next part of the vital signs we do is respiratory rate. What is the respiratory rate? The amount of times a person breathes. That's the rise and fall of the chest. They breathe in a minute. We want that breathing to be between 16 to 20 breaths per minute. We don't want less than 16 unless they came from PACU. They'll be like, sometimes they'll be 15, 14, but we don't really like that. That means that patient is breathing really slow. So we want the patient's breaths to be between 16 to 20. Okay? And then blood pressure. Well, we all know the blood pressure is measuring the force that the heart is pushing your blood. Literally, that pressure that is going through your body. If it's too high or if it's too low, your body can respond negatively or positively if it is good. Okay? So the regular, we like to see like 120/80 to about 135/90, that type of thing. You see, when you reach 150/90, 160/100, no. Or even 95/40 some, 43, that's not a good blood pressure. So we have blood pressure parameters. We will have to do an in-depth video on how to do blood pressure, but for now, blood pressure is part of vital signs. And last but not least, our 5th point is oxygen saturation. What is the oxygen saturation? Oxygen saturation is measuring the amount of oxygen in a person's blood during their breathing. So you put the oxygen saturation monitor on the finger. That's the one with the lights that we put on the finger. You can put it on the ears. You can put it on the toes. It checks the patient's oxygen saturation. What are our levels we like? 94 to 100%. When we are below 94, we kind of get worried. So we look at 94 to 100% as our regular parameters. So remember what vital signs are. We are measuring the body's basic functions. So we check in temperature, making sure the body is regulating its temperature. Make sure the patient's heart is not racing or moving too slow. That's the heart rate or pulse rate. We check the patient's respiratory rate. Make sure our patient is breathing properly so that they can get enough air, enough oxygen. And then we check the blood pressure. Make sure the blood pressure that is not too high and it's not too low, because we do not want the patient to be having lightheadedness, fainting spells, or catch a stroke. Okay? And last but not least, their saturation level, which is how much oxygen is carried in their blood at the time of their breathing at that moment. Okay? So Vital signs, we check it we check it every 4 hours. Vital signs, we check it as soon as a patient comes from the operating room, every 15 minutes for the first hour, then half an hour for 1 hour, then every hour for 4 hours, and then we go back to the 4-hourly vital signs. So you see why vital signs is so important, and that is why it's called vital signs. It is the first indication that something is wrong. It is the first thing that shows us, hey, check this patient. Something's happening. Saturation is low. Breathing too fast. Heartbeat is too slow. Heartbeat is too fast. Temperature is too high. Temperature is too low. BP is too high. BP is too low. So remember, vital signs, it is vital to life. See you guys on the next video. Nurses do it better.